So do you want to talk about something besides vaccines? Yes, please. So what is going around right now is obviously influenza and other respiratory viruses this time of year. And one of the complications that we see from respiratory viruses, say hi, kitty, is pneumonia. So what are some signs of pneumonia in your child that are concerning? How do we diagnose it? How do we treat it? So in general, the two main kinds of pneumonia that are complications after viruses, are we going to be able to do this? Are viral pneumonia, which is where the virus itself kind of overwhelms the upper respiratory tract, gets down into the lungs. And viral pneumonia is usually heard on both sides. It's more common in children under the age of 2. There can be respiratory distress in it, but it's a lot less likely than bacterial pneumonia. So common symptoms about day 5 to 7 after the virus, the child will start to get a worsening cough. It's much deeper. They have a hard time lying flat. They might be up all night from their cough, rarely have a new onset fever, but sometimes they might breathe a little harder and faster. So if your child after day 5 to 7 of a cold seems to be getting worse than getting better and the cough is the main symptom, definitely want to call their doctor and get them checked out. A lot of times we just do vital signs in the office, listen to the child. If it appears to be viral pneumonia and their vital signs are stable, meaning their oxygen, their heart rate, their respiratory rate, they're not dehydrated, we're really just going to say hang tight, and they can cough for 4 to 6 weeks. It's so miserable. But we want to keep assessing them. It's not just a one and done thing because it can get worse. So sometimes we have to support them with oxygen, breathing treatments, sometimes steroids depending on the age of the child, but we want to just keep evaluating them. So every few days, if they're not improving, call your doctor back because we might change our diagnosis as well. If they're not improving or if it's not clear, then a chest x-ray would be indicated to make sure that what we're hearing is really what is going on inside the chest. Chest x-rays actually lag behind the symptoms by up to 2 days. And so sometimes if you do a chest x-ray too early, it'll be normal. But if you do it too late, then you've already missed the ball game. So there's that perfect time in between. Community-acquired pneumonia or bacterial pneumonia is another complication of something like influenza, and it's going to usually be like the 7 to 11 day mark, usually in older kids over the age of 2 or those unvaccinated for H flu and pneumococcal, because those are the two main bacterial causes. This is a lot more rare these days, thank goodness, but it does happen. It's probably way overdiagnosed like ear infections, but it's usually going to be one-sided in one spot where we hear some crackles in the child, new onset fever, worsening symptoms, much deeper cough, and sometimes some increased work of breathing, respiratory distress. This does need to be treated with antibiotics, same kind of antibiotics that we use for ear infections because it's in general the same kind of bacteria. It doesn't necessarily need stronger antibiotics, but it might need longer antibiotics. Don't need a chest x-ray to diagnose it if it's pretty clear. As long as your oxygen level is okay and you're able to stay hydrated, you can stay at home and treat outpatient. Reasons to go to the emergency room. Flaring the nostrils, not able to drink anything, not making any urination, working really hard to breathe. Those are signs that you do need more emergent care. Reasons to get a chest x-ray, like we talked about. If the child is not improving on antibiotics, if the symptoms are seeming out of proportion, or we can't hear anything on the exam, but we really suspect something else is going on, we'd really want to assess with a chest x-ray. So they're not always needed, but they're sometimes needed. So if you guys have any questions about pneumonia, let me know. Take care.